So somebody asked us to do a YouTube on leukemia and optic neuropathy. And you should know that there are multiple different ways that leukemia can present to us with an optic neuropathy. Leukemia means white cells, leuko, in your blood. So when you have leukemia, that is the neoplastic form of the blood-borne cancer when you have increase in the white cells. And that type of leukemia can be acute or it can be chronic. It can be on the myeloid line or on the lymphocyte line. So this is acute and chronic, acute lymphocytic leukemia, chronic lymphocytic leukemia, or acute on the myelocyte line. There are other different types of leukemias that you need to know because the precursor cells can be involved. It can be the B cell line or the T cell line. But really, when we're dealing with leukemia, the liquid form of the white cell cancer, when you have an optic neuropathy, this can be a direct effect of the cancer, and that means it can be infiltrative optic neuropathy, and so there'll be a white thing on the disc, so if you got infiltration into the disc, or it can be in the sheath that can cause perineuritis, so it's in the sheath and not in the nerve itself, rather than in the parenchyma itself. And that infiltrative optic neuropathy can be direct involvement of the leukemia in the optic nerve. That's the thing we're all afraid of. However, it can be indirect because you can get CNS leukemia. So in patients who have ALL, they often get CNS prophylaxis. They have to have their whole spine imaged, and they have radiation therapy of their whole axis, and that can cause papilledema. So the optic neuropathy does not actually have to have an infiltration of the leukemic white cells. It could just be increased intracranial pressure. And because of the hyperviscosity, you might get a central vein occlusion with disc edema, or you might get ischemic optic neuropathy. In addition, once you have the bone marrow making all white cells, you got shut down on the other lines. So you won't have enough platelets, you won't have enough red cells, and even the cells you have aren't going to be working properly. And so you can get anterior ischemic optic neuropathy in patients who have leukemia. And you can get thrombocytopenia, which is going to cause hemorrhage. So that's going to be an anemic retinopathy. So we can get anemic retinopathy, that is an indirect effect of the cancer. You can get direct infiltration, that is leukemia in the retina or the optic nerve, or an indirect effect because you have increased intracranial pressure, either from parenchymal involvement or central nervous system involvement or leptomeningeal involvement from the leukemia. In addition, it doesn't have to be the disease. It could be the treatment of the disease. And one of the treatments that you should know about is in the acute promyelocytic leukemias, those are often given vitamin A analogs. The vitamin A, as you know, promotes the downstream maturation of the cells. And so that is all trans-retinoic acid, ATRA. Because this is a vitamin A analog, it can cause papilledema. So it doesn't have to be the disease, the leukemia. It could be the treatment of the disease, including the vitamin A analog, ATRA. So you need to know a little bit about leukemia. It's white cell, a liquid form tumor of the white cells, direct infiltration, indirect side effects, papilledema, or the hyperviscosity problems, AION and CRVO. And it could also be the treatment of the disease, not the disease itself.